Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. This is my third day with a business suit since the pandemic, since the Agent Summit last year. So I have definitely been in my element, delivering PAC checks, visiting with legislators prior to the Louisiana legislative session. Our legislative team has been evaluating the 3 bills that we know of so far coming out of the Department of Insurance. And as I continue to monitor the possibility of other bills, there is a bill review in Louisiana next week that I will be there to see if there's anything else that affects our industry. To let you know about a couple of things, there is a link in the Monday Morning News from Elena Marino, our legislative liaison from Georgia. She has created a opportunity for agents to input commissions from different states, and it's a one-stop shop that we can put all our information in one place. So take a look, see if you can help us out with inputting some of the data. I did want to send our love and thoughts out to Patty Muller for those that are in Louisiana and worked with her in Ochsner. In the beginning of the ACA, HAFA gave agents to Patty to work in the Vietnamese fishing villages and some of the other hospitals in South Louisiana. And we've had a wonderful working relationship with her. And her son passed, was actually murdered last week, and the wake is today. So our thoughts and prayers go out to her and her family. And just a shout out to all those people, my sister does it, buys things on Facebook Marketplace or Craigslist or whatever. This guy went to sell a dirt bike and the person murdered him. So please, please, please be careful. Tell your family and your friends to be careful in this day and age what you do. I was visiting with Brian McNabb this morning from Senator Cassidy's office and asked him about the DC visits. We've had a lot of talk about when we can go to DC, when we can go talk to folks, and basically DC is still locked down. He doesn't anticipate it to open till maybe fall, so we'll continue to monitor that, but people are not meeting face to face, so we can't have a meeting with anybody in DC. So just keep your thoughts, make plans. As soon as we can go, we will go. Biggest news. Yesterday, the president signed the stimulus package into law. A lot of things that affect our industry. We're still trying to dissect it. I will let you know I'm working with Angie Sura of Navigate HCR, and around the 22nd, we'll lock down the date. We'll be doing an education Thursday on this bill and how it affects our members and our clients. Basically, taken together, the components of the Corona bill represent the biggest expansion of federal help for the health insurance since the Obama-era Affordable Care Act more than 10 years ago. And these are articles that are in the Monday Morning News. I'm just giving you some highlights. Hypothetically, someone that is 45 years old, making $58,000, now gets no aid because they're above 400% of poverty. With this bill that was signed, they're entitled to $1,250 in a tax credit or 20% off of their premiums. And this is according to the CBO. Someone 64 years old, making $19,300, which already gets a subsidy. But with this bill, that person will pay no premiums under a standard plan. There will be a lag as government agencies and insurers, employers unpack this bill's provisions. So I'm in constant contact with CMS. I know a lot of you are posted on Facebook what you've heard from insurance companies. Insurance companies are saying that all this will go into effect CMS will absorb the changes, and it will be seamless. So hopefully that is the truth. I have not got confirmation, but hopefully that is the truth. We won't have to re-enroll anyone. They'll just get more tax credit and their premiums will reduce. As soon as we get information, I'm being promised that there will be a webinar for agents and brokers as soon as all the talking points are created. So if you hear something I don't hear, please, please, please let me know. Let's see. It says the biggest winners will be more than 11 million people already enrolled in Obamacare, as they will receive more tax credit. Let's see what else I wanted to share with you. And again, the industry, insurance agents, insurance companies, as I said, want the agency to automatically adjust what existing consumers are paying and sparing millions the headache of having to go in and reapply. So hopefully it's going to be seamless. What we'll be able to do is help those over 400% of poverty who may not have insurance enroll and get a tax credit, or those that may have two-man groups that the individual premium ends up being less than a group plan, and then you might want to rewrite them with an individual plan. Those who collect unemployment this year, even for a week, would qualify them for the most generous ACA tax credits, as well as the biggest reductions in co-pays and deductibles. COBRA. The bill pays 100% of COBRA. Now, we're not sure how that works yet, how employers will get their money back, or will they have to pay up front, or will the federal government send it directly to the insurance companies? We're not really sure. Those are some of the things that we're working on to try to figure out, but know that that's coming, and as soon as we figure it out, we will let you know. There was another bill by the Think Advisor. Let's see what I wanted to share. The bill eliminates the income cap, the income cap, so the 400% of poverty. The bill also relies people of having to pay back tax credits they received in 2020 if their income ended up being higher than estimated during the enrollment. Now let me read that again. I'm switching to another article. This is in the Insurance News Net article, and it says the bill also relieves people of having to pay back tax credits they received in 2020 if their income ended up being higher than estimated during the enrollment. Definitely interesting. So we'll see how that plays out. Let me see if there's anything else I want to share in this group of articles. Let's see. So a little bit more about COBRA. Normally, you know that the employer can charge the employee up to 102%. This would make the employee pay nothing. Unemployed people who apply for the exchange plan coverage will act as if their income was 133% of the federal poverty level. So unemployed people, they'll be able to go into the marketplace and apply as if they have 133% of FPL. That'll be some direction we'll need from the marketplace on how exactly we input that information, but watch out for that. Basically, they'll pay close to zero for their insurance. So watch out for that. That's another group of people that you could help. And of course, the bill cost and the bill is HR 1319. And I did not include it in the Monday Morning News, but if you need that full bill and would like to read the 639 pages, I believe it is, I'll be happy to send that to you. But it's HR 1319, and the subsidy program is supposed to expire by 2022. But we know once you give something to people, it is almost impossible to take it away. So we will see. I wanted to let you know that New Hampshire's court strikes down the long-term care rate hike caps. At New Hampshire Supreme Court ruling tossed out certain caps on long-term care insurance premiums set by the state insurance commissioner. So information important for our New Hampshire members. Our Florida legislative liaison, Holly Hale, sent a couple of things. SGR 340, the supermajority vote required to enact a single-payer healthcare system in Florida. SB 528, health insurance prior to authorization. And then SB 786, prescription insulin drugs. So those are some bills that are being talked about in Florida. Please, 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 if you're from Florida, take a look at those bills and pay attention. The Benefits Pro has an article about Mark Cuban. He has his own proposal to expand healthcare coverage. The proposal is called the 10 Plan. Most participants would not spend more than 10% of their income on premiums in a given year. I don't know where everybody finds this money tree, but I wish the money tree would start growing in my backyard. Another Biden healthcare reversal, and this is a Benefits Pro article, reversal of the Medicaid work requirements. So that's interesting, something that they've tried to pass in several states. A little bit about the No Surprises Act, the surprise billing that is in the federal budget. Now remember, there's two laws that just recently have passed. One was the federal budget. That includes the Commission Transparency and the No Surprise Act. The stimulus bill that was passed and signed yesterday includes the tax credits, the COBRA, the unemployment, all those things. But No Surprises Act goes into effect January 1st, 2022. Under the Act, both self-insured and fully insured plans must hold plan participants harmless from surprise billing, and it includes emergency and non-emergency services. For emergency services, plan participants will no longer be required to pay more than the in-network cost-sharing amount for out-of-network emergency care services. Out-of-network expenses must count towards a participant's in-network deductible and out-of-pocket maximum. The cost sharing for emergency services may not be greater than the median amount based on in-network charges. Balance billing by out-of-network services providers performed at an in-network facility, such as anesthesia, things like that happens all the time, will not be permitted unless the participant is given advance notice and they consent to the fact that they're in an in-network facility, but their anesthesiologist, radiologist, pathologist is out of network. This calls for an independent dispute resolution. Parties must participate in a 30-day open negotiation process, and if they are unable to resolve the matter by the end of the 30 days, the dispute will be subject to an independent resolution. It's independent dispute resolution, IDR. The IDR entity must not consider Medicare claims data in determining the negotiated price. Now that's huge, because you've heard in many states and in many bills that this is tied back to Medicare. It cannot be in this federal law. All eyes are on Department of Labor, Department of Treasury, and Department of HHS. They will be the ones that promulgate the rules about the surprise billing legislation. And we will find out more and more about that as we go forward. And this information came from the attorney at Hush, Blackwell. So I believe I included that in the Monday Morning News, but if for some reason I did not, please, please, please just ask me and I will send that together to you. Let's see. I just put that in the back. So I believe that's it. It's a lot of information to digest. Know that if I was you, I would send something out to my clients to let them know things are changing. These are some of the things that are going to happen. You will receive an additional tax credit. COBRA will be covered at 100%. And as we learn how that works and what the pieces and parts are, that you will let them know. But they're going to be hearing a lot of things. They're going to be asking a lot of questions. Go ahead, nip it in the bud. If you use social media, if you use video chat, however you use it, if you send out a postcard, let your clients know that things are changing. Remember, knowledge is power. And if you do not tell somebody something, somebody else will. So these laws do not just affect our individual members. They affect our individual, our group, everybody. Anybody you touch, these bills are going to touch. So have a wonderful week. I'm still reading the 638 pages. I get glassed over after a while. It's just a lot in my brain, and my brain starts to swell. But know that not only am I reading it, but it's important that I listen to other folks and I learn from other folks that are doing webinars or doing a digest. So I absolutely am learning and continue to learn and promise to be the best that I can for you. But call me if you need anything. Please reach out, send me an email. Always remember, if you don't hear from me within 24 hours, to reach out again. It means I missed it. Please reach out to my direct email. If you send something to HAFA at HAFA America, sometimes I'm a little delayed in answering it. If you'll send it to Ronell at hafamerica.org, I'll see it a lot quicker. I'll get to it a lot quicker. But proud and honored to represent the HAFA Freedom Fighters, the cream of the crop, the best of the best. I love you guys. Until next Monday.